Dr. Zenithson Eng, or Zini Eng, is a clinical assistant professor of community practice at the University of Tennessee College of Veterinary Medicine. He received his undergraduate degree in animal science from Rutgers University and a veterinary degree from Cornell University. He completed a small animal rotating internship at the Berg Memorial Animal Hospital of the ASPCA in New York City before entering a combined ABVP canine feline residency and master's degree in human animal bond studies program at the Virginia Maryland Regional College of Veterinary Medicine. And Dr. Ng was just telling me that in between his internship and his residency, he actually also worked for 6 months at a small animal practice in China. While he's at Virginia Maryland Regional College of Veterinary Medicine, it's through this unique program that he's able to enhance his medical and surgical skills while developing expertise in human-animal relationships. His clinical interests include dentistry, behavior, preventive medicine, and management of chronic disease, all the things I dislike. His research interests include the effect of animal-assisted interventions on both humans and animals, communications, and the veterinarian-client relationship, and stress and animal welfare. Outside of work, he enjoys traveling, any kind of pizza, horror movies, roller coasters, and crisp fall days. Welcome to the podcast, Dr. Ng, and thank you so much for being here. I know how busy you are.
Thank you, Dr. Gug. We're very appreciative to be on here.
We were talking before we started recording about you obviously wanted to be a veterinarian since you were a very little kid because you showed me the poster that you had when you were a little kid. So how old were you when you found that poster?
You know what? I actually got that poster. One of my friends from college actually got that for me as I was just in undergrad. But
okay.
Actually sitting in my childhood room right now because I'm with my parents over Christmas. And so I found this poster because there's nothing else up on my walls right now. So I was like, this sounds appropriate. But somebody had actually plastered my face on this little kid's picture and everything, and so this hung up in my room, kind of reaffirming my dream of becoming a veterinarian.
So for the listeners who aren't seeing the video, the poster says, "I want to be a veterinarian," and it's a picture of a veterinarian, but somebody has cut out a picture of Dr. Ng's face and put it on the veterinarian in the picture. That's why I thought you did it when you were a kid, because I'm like, oh, that's something I would do as a kid. But it was like a friend of yours who posted did that.
Which actually, it's supposed to be for kids and everything, because it's a little kid's body who's in like a white coat. And then they put my picture on it. It says, veterinarians' tools help them treat sick animals. Most veterinarians work at animal hospitals where there are examining rooms and operating. Farm veterinarians may wear overalls and tall rubber boots. So that was just kind of what do you want to be when you grow up? And so that was mine.
Did you want to be a veterinarian since you were a kid?
Yeah, actually I did. So ever since I was as far back as I can remember, because my neighbors always had animals. They always had a zoo going on there. And my cousins had dogs and everything. And so everybody else had animals except for myself, because my parents were like, no, that's not going to happen for you. But slowly as I told them that, hey, I want to be a veterinary doctor or so when I grow up, and I got them to get me hamsters and birds and fish, every other critter around and everything, so that they can foster me being a vet. So that's kind of how I got into it.
Okay, so your parents were supportive of your dream of becoming a veterinarian?
Not quite at first, obviously. And so my background is I'm Chinese. And so I grew up in the suburbs of New Jersey. So I was one of the very few non-white people growing up in here. And my parents and I'm first generation Chinese born. So my parents were born in China. Mm-hmm. And so their dreams for their kids is just to be you have to have a career that's going to make you a lot of money and everything. So you have to be a human doctor or a lawyer or whatever else, a banker, anything that's going to pay your bills. And so when they learned that, I was like, I want to work with animals. They just kind of thought that animals were dirty, they're smelly, that what do you want to do? Why do you want to do that and everything? But I think I was pretty adamant about pushing my dream for them. And once I realized that, once I got to high school, when I was taking like biology classes and chemistry classes and all those things to be like, hey, I want to go to veterinary school. I think they finally were like, all right, we'll let him do this and we'll let him fail at it and everything so that he could go on to do something different. But
it'll let you fail, let you like not get into vet school, and then you could be an MD instead.
Yeah, exactly.
MD's listening. No offense, but
yeah, no, definitely. But actually, it wasn't until they realized how difficult and challenging it was to get into veterinary school that they finally developed a little bit of respect for it and everything. So it's been an interesting evolution. But being a vet is actually the main one thing that I can always remember from being a kid.
And do they get to visit you at University of Tennessee ever, like when you're on?
Yeah, absolutely. So they come in. They've actually been coming probably at least once a year and everything to come and stay with my place and everything else and visit. So
that must make them very proud, because I mean, I think like academic teaching hospitals are, you know, they're pretty badass. Pardon my French, but you know, if you've got a kid and he's working at an academic teaching veterinary hospital, then that's like the creme de la creme. Like, you've got, you know, that's impressive.
I don't know if they see it just like that, but they know that I'm very happy. So that's really what matters.
Okay, and then so when you started veterinary school, did it meet your expectations? Was there anything surprising about it? What did you love? What did you not love?
Vet school. So, veterinary school is a challenging, but rewarding experience. I think that any sort of training program is going to be. I think that you have to expect to work hard, no matter what, and everything. Expect to, and this is probably my advice, is that I rarely sleep. My sleeping habits are terrible because I stay up late, I cram, I procrastinate, and everything. And so I was still able to make it work and get by. I definitely do not consider myself like a smart individual. I had to work in order to get by and everything else. But I would just recommend that everybody sleep and take care of themselves. But I guess one of the big things that I didn't expect about veterinary school was how small it was and how kind of high schoolish it is, as far as you go from especially coming from an undergrad where you're with hundreds and thousands of other people. In veterinary school, it is a very small community, and so we had 86 people in our class, and the majority being women, and so things can get catty and everything, and a lot of drama, a lot of high school drama, a lot of talking back and forth. And so it's just kind of wow, did I just kind of go backwards and my education for being a professional school too? And not saying that anything immature about anybody there, but it's just kind of the experience that I was like, oh, this is interesting. So people are really people. I just thought that veterinary school was actually just going to be a bunch of nerds and all that. But I mean, they're great people. And the things that I really advise people to do is to get sleep, take care of themselves, cultivate their relationships and friendships with their classmates and everything that is going to last you a lifetime. I'm so grateful for all the people in my life, but especially my friends from veterinary school. And then also foster relationships with your professors. That's the other thing that when you have a good mentor, that can take you so far in life, and really mentors who are there for you for life. And so I have quite a few mentors who have helped me along the way, and who I look up to and everything. I think those are really important, influential people to have in your life.
And did you have mentors who were veterinarians, like when you were an undergraduate or before you got into vet school, or did they all
Yeah,
come from vet school?
no, absolutely. I think that all stages of my life, ever since like starting being a kennel worker, when I was like 16 years old and everything in my hometown, I still keep in touch with that veterinarian.
Wow.
And then throughout undergrad and everything, I actually had one of our professors or two of our professors were veterinarians, and so kind of looked to them for advice and everything, and worked in other different clinics before then as well. So every step of the way, you learn something new, remarkable from a different veterinarian along the way. So it's really
Well, tell me this, Dr. Ng, because I've never been good at like finding mentors. I've had some mentors, but it just sort of happened organically. But you seem to be much better at it, and you're still like in touch with people that when you were a kennel helper, just trying to get your animal hours to apply for vet school. So, what's your advice to future veterinarians as far to how to find mentors, or how to ask somebody to be a mentor, or do you ask them?
No, absolutely. I think that what you said is true. Is about how kind of your mentorship and your relationship that you build with somebody is very organic. It's very raw. It's not like, oh, will you be my mentor or official? It's kind of just like finding oh, you know what? Like I love, or like when I was a kid working at the clinic and everything, I like watched this veterinarian in surgery, and I had just had tons of questions just because I was so interested and engaged and everything. And I think that anybody who does want to be a veterinarian should be engaged, and they should be inquisitive and everything else. And so I think I'm a big question asker. So I guess whenever I meet people or I see somebody who's doing something like exciting, like my mentor from when I was a kennel worker, he went to veterinary school in Scotland. And so I had all these questions about it and everything. I was like, how'd you go there? And he actually ended up going to the same undergrad that I did at Rutgers that I did. So there were a couple of similarities. And so I think it was just building that relationship, finding the similarities and asking questions of them, like, how did you get to where you are today? And I think that if a good mentor is going to be very forthcoming about their experience and want to say, hey, I can help you out at any time. If you have any questions, please reach out to me or so. So I think that it has to be a two-way street, that the person who wants to have some mentorship has to have that inquisition and has to have that curiosity. And the person who is mentoring should be willing to be like extending a hand forward when they see that. And so keeping in touch. And I think that it should always be the mentee who kind of like reaches out and is like, hey, I just want to check in, or I had a quick question, even if it's just a short email or a phone call or anything, just to reach out. And I think that, and then throughout veterinary school, as my interest kind of became more narrowed, or I kind of realized what I really did like doing and everything, then I had those specific questions. I sought out those mentors, and it wasn't like ever like a formal question of will you be my mentor. It's just kind of like this person became my friend and confidant or whatnot, and kind of guided me along the way. And so I still keep in touch, with a lot of them, because I'll always have like random questions that come up, or about things like right now, like the tenure process. I'm like, oh my goodness, these papers and all these other things. Like I'll send emails to all of my old professors and everything, and be like, did you ever go through this? And they'll kind of commiserate and be like, yes, it's a miserable experience or whatever else. But so I think it's just developing good relationships and maintaining them, and having like similar interests is a big part of that too.
Right. That's really interesting, because when you said, ask questions of them, I was thinking, are you asking medical questions? Are you curious about, because when I was working as an assistant, I was always like curious about the medicine, but, I didn't want to be obnoxious asking about something that I would have no clue of. So, but you're talking about asking about them personally. How did you become a veterinarian, and how do you feel about it? And being curious about them as a person because you want to be them someday.
Yes, exactly.
That makes sense. Yeah.
Oh, definitely. But anything that you have as a similarity, or asking them any questions, not to be obnoxious, or it's true. Like I think that you can be a little bit too much in the question asking, but I think it's a two-way street. You can read them and be like, all right, this person really doesn't want to be bothered, or they don't want to be bothered with with helping out somebody. And there are plenty of people like that out there who are like, I don't have time for like this pre-vet student or whatever else. Like hopefully there are fewer. Right. But I feel like many people and everything would be happy to extend a hand and being like, oh, I'm happy to answer any questions or anything else like that.
Right. I still think it's really fascinating because all of my questions were about like the science of medicine and all that stuff. And I remember once I became a veterinarian, I remember I can't remember what her role was. She was a receptionist or something like that. And it didn't even have plans to become a veterinarian, but I was reviewing some blood work on a patient and she was standing behind me. I had the blood work up on the computer screen and she said, explain this to me. And I was just like, woman, no, I cannot teach you to be, a veterinary medical doctor while you're standing there. But if you ask questions like, so do you like being a veterinarian, or, where did you go for your undergrad? And that's maybe something more relation building question rather than your kind of annoying question, right?
Yeah, exactly. Like if you definitely the interest in like the science and the medicine and everything of it is great, but it also has to be done at an appropriate time. I think that there's an appropriate time for questions and everything, like not when a doctor has like 5 appointments that are like double booked and they have another surgery coming and all that. So kind of just knowing your place and knowing when to be respectful about that. Because that definitely can be annoying when you're trying to get things done and then you have like a little person kind of questioning everything that you're doing. So
yeah, and it's like, well, it's 8 years of school. Don't know if I can condense it into 5 minutes, but okay. So then your after vet school, that's when you started your small animal rotating internship at Berg Memorial Animal Hospital. Tell me about that. What was that like?
Yeah, so that was actually, so if you ask anybody about what their internship experience is like, I think that they'll kind of say the same things about it's challenging and it's a lot of work and I suffered through it, but I'm glad that I did it. And so that's kind of like always like the response I usually get from people who have done internships. And I was not looking for that for an internship. Actually, right after or like during veterinary school, I said, I do not want to become a specialist. I do not want to do an internship. I don't want to do a residency. I don't want further training. I'm done with school. I'm done with everything. I just want to go out into practice and everything. But again, when it comes to mentorship, actually, during one of the summers of veterinary school, so I always did like summer internships or whatnot during vet school, like summer research internships. And I was really, my interests were really honing in on the reason why I became a vet was actually not like as much as I loved animals, I really loved working with people. So opposite of what most veterinarians kind of say, but I wanted to blend the two fields together and be like, you know what I enjoy most out of anything is seeing the people who are so like appreciative and happy and just like wonderful that you're taking care of their animal, that you've made their sick pet and everything well. And so I really, one of the big reasons why I say I became a vet was because I enjoy helping people through helping their animals. And so that was my one way that I was like, this is the perfect profession. And so I really got interested in this whole idea of the human-animal bond and human-animal relationships and and talking about like communicating with clients and all of those like kind of non-medicine-y type of aspects of veterinary medicine. And so I was really interested in this whole idea of like therapy animals and all that because my parents wouldn't let me have like a big dog or cats and everything. I was just trying to find ways to kind of sneakily get them in. And so in my 8th grade science fair project, I actually did this research project looking at the effect of different animals on people's blood pressures, because I had always had the thought that, animals are going to make you calmer and they're going to lower your blood pressure and everything. So I really had this whole idea about working with people. And so through vet school, I was looking for something for a mentor who would foster this whole like human-animal bond interest that I had. And so one of my mentors, and her name is Dr. Brenda Griffin, she's an internist, but she's also a shelter veterinarian. So she's kind of paved the way for shelter medicine in veterinary medicine. And so I started working with her under that guise. I was like, hey, I'm really interested in this. And she had won like one of the big AVMA Human Animal Bond Awards before. So again, like all those things that was like, I really like this lady. I want to be this lady and everything else. And I was just so amazed by what she had done. And so because of her interest in shelter medicine, I was really like enthralled with the whole idea of finding that bond, of helping animals to help them find those forever homes and everything, and taking care of them and looking at the relationship between humans and animals. And because of her, honestly, and because of that shelter medicine program, even though I was like, I'm not doing an internship or whatever else, like I saw the ASPCA's internship and I was like, you know what? I was like, that seems a little bit interesting. And so I went down in New York City and went to visit. And honestly, it was one of those feelings that you just get. And I'm like, I'm in love with this place. This is exactly what I want to do. And so I like interviewed with them and everything. And I was like, this is really exciting. And so they ended up being, because of this program, and it was a regular rotating internship and everything. They had internal medicine specialists, surgeons. And then the really great thing about it was that you got some time on on general practice where you actually were the primary care doctor. You spent a rotation on the humane law enforcement service, where you worked with those cruelty cases and everything like that. And then you spent a rotation in the actual shelter, so treating all those shelter animals as well. So it was a very there was such a diversity in the things I was able to do. And I have to say, as much as everybody kind of harps on their internship experience as not being the greatest one, but they learned a lot, I loved my internship. I can't recommend it enough to anybody who has an interest in that area. I really felt like we were treated as doctors and we were treated respectfully. And also working in a shelter a little bit also helped you realize that you made a difference. Like I feel like at other internships and everything, you're just kind of the pawn for some other specialist or so, or and things like that. But really working at the ASPCA, I felt that us as interns, we were able to change the life of an animal and for a client and everything else. So it was really a fantastic experience. And I can't say I actually did get sleep. I had tons of fun. I loved the people that I worked with. Again, the mentors and also my intern mates and everything. It was just a very positive experience overall. So
did you have emergency duty during that internship? Did they have an emergency hospital?
Yeah.
They
Mm-hmm.
did. Okay.
And so there was emergency and treatment care and everything, but they closed their doors at 6:00. So after 6:00, they didn't have overnight emergencies.
Oh, okay.
We kept hospitalized patients. And so we were on call for those hospitalized patients. But overall, there were no more walk-ins and everything, which really makes for a nice, for at least a work-life balance scenario and everything, a good thing. But yeah, we were on call for patients and everything that we had admitted. But after a certain time and everything, it was all right, you're going to the animal medical center down the street if you had an emergency. So.
Oh, interesting. Because I think that, so did you hear about the ASPCA, or the Berg Memorial Animal Hospital, the ASPCA internship? Did you hear about it through vet school or through, the VIRMP?
MP. You know what? I think I originally, because again, I was so tuned into not doing an internship that I think it was through my mentors and the people and other people who had done the internship before who had come back and said, hey, it's a really great one. You have autonomy, you get to do a lot of procedures, and you get to be the veterinarian and everything. And so I was really excited about that, and absolutely, I loved it. It was a fantastic experience.
So I didn't do an internship, and I had the same kind of thinking as you. I was actually no way. Why would I become a slave for no money when I can just start working? And
yeah, absolutely.
But it seems like I've been doing some research on this. I recently wrote an article for my blog on what to look for in an internship, because there's no regulation, there's no standardization of veterinary internships, unlike human medical internships. So you can get into a bad internship. There are great internships and there are bad ones. And it sounds like one of the things in particular is when they have overnight ER duty for their interns, right?
Yes.
Sometimes it seems like the not so great internships are actually just looking for cheap labor, somebody to do overnight ER.
Yeah, exactly. And that's what the majority of those internships will be. They'll say like they're 50% ER duty. And most of that 50% is that you don't have like a backup or you're the only intern working overnight and everything. And so you don't have somebody to actually mentor you and everything.
Right.
There's really tough situations. And
Yeah.
that's scary. It makes you, it's kind of a sink or swim situation where it's like it really tests you out and everything. And I feel like most people who are in those internships, they're there for that experience and everything, or they're trying to go on to residency and everything. So they're going to do everything that they can to kind of make it through. But
Make it through, right. But,
yeah.
you know, like I know that on the, is it VIRMP? Is that the right acronym for the?
Yes, Veterinary Internship Residency Matching Program.
Matching program. You can actually look at some of these programs and they'll say, you know, 20% ER duty, you know, but then sometimes it does end up being 50%. So it's just one of those things that you have to verify.
Absolutely.
But it's, okay. I'm wondering though, if because you didn't have overnight ER duty, maybe that's what made it a little bit more pleasant for you doing an internship.
Yeah, exactly. No, it definitely, because there were, and so this is in New York City. So there were three other big internship programs in New York City. Those being the Animal Medical Center, the New York Veterinary Specialist, the Blue Pearl, and then a place called VERG, Veterinary Emergency Referral Group out in Brooklyn. And so it was really great because one of the pharmaceutical companies would sponsor like kind of a once a month CE or so, where all the interns from all these programs got together and we got to do, maybe it wasn't once a month, but it was, we saw each other and everything frequently and everything. And it was great and everything just to see the interns from the other programs. But I think that we were definitely the happiest out of all of them because we probably didn't have those duties. But I think that, it's hard because you just have to understand, like everybody's like, you can do anything for a year. But I mean, if you're going to suffer straight through that year, you really have to like kind of think about what your future is, or like, is it really worth it? So
there's some suffering that's worth it. If you're learning a lot, then I think it's worth it. If you're not getting the mentorship, then I think you're being taken advantage of.
Yeah, exactly. That fine line and everything. So that's why I think it's important to speak to your mentors and everything, get their guidance of what their opinions are. And so like my mentors were like, absolutely do it. You have to and everything. And then also speaking with the current interns and kind of their staff and visiting and finding out if it truly is a match. It's not just like, oh, I'm just going to apply to the top programs or whatever else. You have to see, do you fit in there? Is it the type of medicine and surgery and everything that you want to be practicing? And if you do want to become a specialist, do they have that specialty in there and everything? And so again, even though there was an internist, an oncologist, a surgeon, that I wasn't interested in a specialty in particular or whatnot. I was interested in just going out to practice or working in a shelter and everything, honestly. So that's why it was a perfect fit for me.
And then, but when you finished your internship, then how did you end up in China working for 6 months at a small animal hospital?
Yeah, so during my internship, I was trying to figure out, all right, what do I really want to do in life, and all that. And so I was applying for jobs and everything, mainly in New York City, actually, to staying in New York City. And so all of a sudden, as I was scrolling like the posts and the job postings and everything, there was this one section that says, "Do you want to work in China? Come to China," and everything. And so that had always been a dream of mine and everything, to go to China and everything. Actually, probably with my parents and everything, just to visit and just to see, because I'd never been before. And so I saw this posting that was like, we're looking for an experienced veterinarian who can come and like westernize our practice in Beijing, China, and all that. And I was like, that's an interesting thing. And I was like, well, I definitely do not have the experience or the know-how to be able to, I don't know, help out people. Because it wasn't like, oh, just be a vet. It was like kind of teach our Chinese veterinarians a little bit more about westernization.
And do you speak Chinese?
No, I did
Yes,
not
me
know.
neither.
Shame on me, because that is, and I always knew as a kid, or my parents would always tell me as a kid that that's going to be my greatest regret. But it was hard. Like again, like I was the Asian kid living in the like suburbs of New
Yes.
Jersey, where nobody else was speaking Chinese, but my parents did, and so I understand like a good amount and everything when my parents are speaking to me in Chinese, and I can like kind of piece together some words. And oh, and just to kind of clarify, the two types of Chinese, there's Cantonese, which is made like southern China, like Hong Kong or whatnot, and that's where my family is from, and so that's what we speak.
Mine
As
too.
Oh, that's funny. And then, but most everybody in China speaks Mandarin, which is like the main, like national language, and that's what's in Beijing. But and even though the written language is similar, like the way that they sound and everything, there's some similarities, but overall, like it's a completely different language. And so, like when you're speaking Cantonese to Mandarin people, they're like, I have no idea what you're saying. So my know-how is very limited. I tried like Rosetta Stone for a little bit, but I didn't really make it that far because the hospital was bilingual, so they translated everything for me, and it was mainly geared towards like expats and Westerners and everything who did speak English. And anywhere that I went, even though English was limited, I usually had somebody who was with me who could speak Chinese. And it's funny because a lot of times it would be like a white person who would be speaking Chinese for me.
Oh my gosh, that's so funny.
And all the Chinese people would be like looking at me like I'm stupid and everything. They're like, "What's wrong with you to have this white person speaking Chinese for you?" But yeah, it was a great experience. So anyway, I found out about this experience or whatnot, and I was like, I'll just like send him an email and just see like what it's about. But knowing that I'm just coming out of my internship, I'm probably not qualified. But I ended up speaking with them further, and like I was like, wow, I was like, this seems really exciting, and like it's something that I've always wanted to do, and to be able to be a vet out there and to actually work and have things paid for and to get paid a little bit of money and everything was a really exciting prospect. And I didn't have any other specific plans, and I was like, I'm young, I'm like, I'm ready. I was like, let me do this and everything. So
okay. I'm sorry to interrupt. But I need to know more details about this because I actually worked as an expatriate. I lived in Asia for like 7 years.
Oh, really?
Yes.
Okay.
Yes. And so, expatriates, usually when they bring you over from the States, and it's probably totally different for veterinary medicine. It's not like you're working for some big corporation, but usually when they bring expatriates over from the US, they have like a great salary, and they like pay for they pay for this like beautiful house, and you have maids and a swimming pool and a chauffeur, and like your kids go to private American school. And so it wasn't like that.
No, it was not. But it was like that for all the other expats and everything who are out there and everything, because they were mainly like with the embassy or with big businesses. So that's one thing that, I mean, I could go on with that whole China thing. Could be an entire like couple hours of talk and everything.
Oh, I swear.
But I was amazed because everybody there did live that lifestyle. If they were not like Chinese born, if they were not a native of Beijing, like they lived like kings because everything is so cheap, and everybody had a maid. Like everybody had like a cook, somebody to clean the house, somebody to drive them around, and the people to take them to the vet and to take their animals to the vet and everything. I was just like, where are we? And all that. But no, as veterinarians, I was not living that lifestyle. I lived in this like shiny little apartment. But I mean, like it was fun. Like I definitely had enough money to like still travel. Like I went to like Korea and Thailand and all over in China. So it was really a wonderful experience.
And may I ask what year it was when you were there?
It was 2000. It was right after the Olympics. It was right between 2009 2010.
Okay. So that's almost like I was there, I think, in like 1993 or something like that.
It was a much different place.
A much different place, yes, because when I was there, they did not even allow dogs in the city of Beijing.
Yeah, absolutely. So I have the entire history and everything about that, about when they started letting the animals in, and then they had to be under a certain height, and then like there are all these strict regulations and everything about rabies and all that that other stuff. But again, like to kind of put it in a small ball, because I have an entire talk that I do about about this whole China experience and everything. But pretty much the owner of this hospital, she's Chinese, but she was born and raised in like New York City. She went to Columbia for her MBA and everything, and she was like a businesswoman. And so she ended up doing business in China, but she had this cat, this beautiful like white Persian cat and everything that she loved and adored. And all of a sudden the cat got like a toe infection or something like that. And she freaked out because she was like, I have nowhere to bring my cat. Because there were plenty of Chinese veterinarians, but she was like, I don't trust them as a link or anything. So she's like, what do I do? And so she, like, because she was working for a big company, she was like, I'm going to fly a veterinarian over from the US to like help me treat my cat and everything and to do all this. And so she pretty much had the thought of like, if I'm feeling this way, then she's like, there has to be like plenty of other people who feel this way as well, of just wanting a quality standard of care and everything for their pets and everything when they're living out there. And so she created this hospital pretty much to fill that niche and all that. And she did a great job in creating this. And I think she built this practice in like 2006. And again, she's not a veterinarian, but she kind of teamed up with another business person and all these other vets. And so she mainly trains, or she has Chinese veterinarians, but she commonly has like kind of westernized veterinarians come and help them like kind of teach their ways and show them how to do things like that.
Wow. Okay. So, and that's what you were doing, is you were basically teaching Chinese veterinarians who had studied in China.
Yes. Mm-hmm.
Western ways. So what were some of the major differences that you noticed?
Well, they have a lot more regulations on their drugs. So like they cannot use opioids as pain medications for their animals. Huge challenge.
Oh my God.
Yeah. And so there were only certain drugs that were permitted. And so we used a lot of NSAIDs and things like that. And I mean, they just had basic like x-rays and blood work. They had a blood work machine. And I think one of the things that I kind of noticed, because we saw probably about 60 to 70% of expats, and then probably 30% were like native, Chinese people. And I would say that one of the other big things that I noticed there was that people didn't really euthanize their pets. I think that there's a culture of, if a pet is going to die, it's going to die and everything. And so I think that the one or two euthanasias I did was like in a turtle that we had to get, and because again, we didn't have barbiturates, we had to use potassium chloride to like inject into these animals and everything as their euthanasia, which was like a whole time. If you've ever euthanized anything with potassium chloride, you always think that, oh, I'm going to overload this patient on potassium, but it takes a lot of it and everything in order to actually have their heart stop. So drugs was a big thing, and their training, they just don't have, and it's it's not their fault and everything, that they just don't have the training that we do in the Western world. Where their veterinary medicine is probably where we were in the US in like the 1970s or so and everything. With just like, we know the basic things and all that. We're going to treat everything with antibiotics, steroids, and B12 injection and everything. It was kind of that sort of practice. And so being there really helped me hone in on like how to teach, actually. That was one of the biggest things I learned there and everything, how to teach in a different language and how to make things clear and how to like simplify things as much as possible was a big thing that I learned. A wonderful skill that I did learn, communication skills and everything. And then like I helped them out with doing like their first, and I told them, I was clear. I was like, I don't have a whole lot of experience. I'll tell you what I was taught, and I can look up things on like VIN and in textbooks. Oh, that's the other thing, is that because their textbooks are translated from like our like Miller's Anatomy or Enger's internal medicine is translated into Chinese, you have no idea who's actually translating it, because like there's a lot that is lost in translation between those, especially with medical and veterinary translations and everything. I'm like, do I trust what they're what they're saying or whatever? And if they got something backwards or if a decimal point was moved over. So like those are big things that I'm like, I'm not quite sure about that. But it was really a chance for me to be like, because there were no other specialists or whatnot, that they're like, all right, you're going to take care of this. Like, it's either you or this patient doesn't get cared for, which is really stressful. But at the same time, I was like, I don't know if this is going to work, but we're going to do our best and everything. And so, like, we helped doing like their first blood transfusion. I helped them out with like dialysis, like an intraperitoneal dialysis. I did like enucleations. I did like all these other cool like procedures and everything that I definitely wouldn't have done here or been like, this is probably not appropriate to be doing, but it really tests your limits. And the other thing that I learned is that I think that animals, if they're meant to live, they're gonna live. And if they're meant to die, they're gonna die. Because there were some things that I was like, I would never do that, and things like that. When as far as their animals go, but the animals made out just fine and everything. And that, yeah, all these things that you're like, never, ever, ever do this or that. Things like that. Like every animal got Baytril or fluoroquinolone with every surgery and everything like that. Like, but all the animals ended up doing just fine. So I was like, wow, okay. That's interesting.
Did that make you uncomfortable?
It did, but I mean, I wasn't licensed as a veterinarian there, so it was kind of like all I can do is tell them, hey, you know what, and not to be condescending, and also to have those communication skills and not be in a condescending tone is the other way, is the other big skill to kind of learn over there, is to be like, I probably wouldn't do that, and these are the reasons why, and everything else. Like, I wouldn't give steroids to this patient or whatever, because they can ulcerate, they can have this effect or that effect. And I wasn't the actual primary doctor or whatnot. It was a Chinese doctor who was administering, and it's their name who's attached to it. And they just made a decision. They're like, no, we're still going to do what we've always done for the past 20 years. And I was like, okay. I was like, well, yeah, that's that. We'll see what happens. And
you were not the attending.
No. I was like their support and everything, which was an interesting role. But usually a lot of the times and everything, the animals would actually fare. I was like, oh my goodness, this dog is going to keel over, but they ended up doing fine. So like against like all of like the papers and the research and everything like that we talk about, like sometimes like, yeah, I think animals, if they're meant to survive, they will.
It's funny because, even in the United States, you got some vets who've been practicing for 30 years, right? And they're still practicing like that. Yeah, and, new grads with newer information, we come out and we're like, but when they do it, it turns out fine. But I will say, if you try to do what they do, don't expect to get their results. I think that, honestly, like I've noticed this. I think that they have an intuition that, maybe they can't articulate, that, new grads, we're like, we've been taught not to do that. Don't do that. Don't do that. That's wrong. And then you see them and you see success and you're like, I'm going to do that. And then it goes wrong.
Yeah.
Because you don't have
that's the way that the world works. Yes.
Yeah.
Absolutely. So
fascinating. Okay, let me ask you this. So ketamine, did you have ketamine?
Do you know, we did not have ketamine. However, there was a drug, like an anesthetic drug, that was called it was called Basilu, which is like kind of 845, and they had no idea what was in it. And my best guess as to what the actual concoction was probably some sort of like tilazol, ketamine, sort of like kind of mixture. But overall, no, we didn't have ketamine as like its a lone drug and everything available to animals.
Because if I remember correctly, and it wasn't too long ago, it was probably after you were there, but it wasn't China pressing to get ketamine, like the controlled substance rating increased on ketamine, or actually make it unavailable or something like that?
Oh, really?
It was used as a recreational drug really frequently, and I think it was in China.
Interesting. Oh, I don't know much about that, or I haven't heard specifically about that, but I can only imagine about the drug dealings. But their government, their oversight on drugs in veterinary medicine is very strong. So, like, yeah, that's tough.
Wow. And did you have access to the internet? You mentioned VIN, Veterinary Information Network.
Absolutely. That's what I was on like every single day and everything. I was printing out articles for them and other like kind of teaching things like that for everyone.
Okay. So you didn't feel any restriction in terms of the internet while you were there?
No, I mean, like they do have whatever, like a VPN or like things that block, like the government definitely blocks certain like websites and all those other things. Like Big Brother is always watching, but we had like this other, I don't know, something to get around that barrier or that block. But I know that VIN wasn't anything that they would block or anything like that.
Okay. So. I swear, Dr. A, I could talk to you about this all day, but I know that your time is limited and there's so much in your professional experience that I want to delve into. So if you don't mind, let's move on to your residency at Virginia, Maryland. And I remember you, I don't think I ever worked with you directly, but I remember you being in clinics when I was on clinical rotations.
Yeah. Mm-hmm. And so I was pretty much in between that like a year and everything. I was doing like some locum work and everything in private practice, and then like doing the China thing and all that. And so it was a really exciting experience for me all around. But it was funny because this residency, again, I had always been in the situation where like when I originally was planning when I came back from China to just go back into private practice and everything. And I was like, all right, that China thing is going to be like the peak of my career and the most exciting thing that I'll ever do as a vet. And so when I was like planning on coming back, I was like, all right, I got to look for jobs again and things of that nature. And then all of a sudden, one of my friends from vet school and everything, who was also interested in shelter medicine and things like that, she had sent me this ad posting and everything that was for a residency, was for an ABVP residency at Virginia Tech. And I was like, oh, that's an interesting thing. And I hadn't known, and most students don't know what ABVP actually is, which is the American Board of Veterinary Practitioners. And it is kind of, so it's not specialty, like as in like, you're not like an internal medicine specialist or surgeon or ophthalmologist, but it's rather kind of like developing your expertise as a general practitioner in a specific species. So ABVP boards like doctors who are species specific, either in like there's ABVP equine, there's bovine, there's porcine, there's avian, exotics, all those things. And then there's a canine feline specialty. And so I had heard a little bit about this because that's the way that shelter medicine is being boarded, is that you can get your ABVP credentials in shelter medicine now. But they had this canine feline practice. And so I was like, that's an interesting thing. Like if you just want to distinguish yourself as kind of that you practice this standard of care, because obviously you can't really tell one veterinarian, like just from like looking at their profile, one veterinarian from the next and everything, if they're just DVM after their name. So if they have credentials, it means that they either suffered through some sort of residency or other training program to kind of be like, they want to practice the best standard of care. So as far as this residency goes, I was kind of like, that sounds interesting. But what really fascinated me was the fact that it was combined with a master's in human animal bond studies. That's what they actually called it. And so because when I was coming back and everything, I was like, I really was thinking about going back to school for social work or getting my PhD in like psychology or something, again, to enhance that whole, like, to figure out what I wanted to do with these people and everything. Like, again, like either working in shelters, working with therapy animals or whatever else. And so all of a sudden it said it's a master's in human animal bond studies. I was like, whoa. And so my friend was like, this looks like it was like written for you. And so I was like, no way, this is crazy. And so actually for my Skype interview, I actually Skype interviewed Dr. Pierce and everything from China while I was still there and everything about this program. And I had done everything. And so I was talking, and I had worked with another psychologist and everything at the ASPCA. And I was asking her, I was like, what should I do? Like, I was asking everybody. That's how I got a lot of mentors, was because I was like, I don't know what to do, because I still want to be a vet. I want to work with people. Like I do. And I was just like, I don't know what I can do. And they're like, and one of the And I was like, should I go to social work? Like to go back to school for social work? And they're like, not if you want to make money. And I was like, okay. And my sister is a social worker as well. So I kind of know the way that goes. But their best advice for me was go back to school to get your MBA, because that would be a very diverse degree to have. That way that you could like kind of provide leadership in any sort of organization, nonprofit or otherwise. And so I was like, okay. But then once I heard about this program of like being involved, like taking courses and doing research and human animal interaction, I was like, that is exactly what I wanted to do. And so it was my chance to still be a veterinarian and everything, and to practice and to increase my skills and all that other stuff, while at the same time being able to like kind of focus on this whole human animal bond thing. And so it was a 3-year program that I came while you were there. And so I was so excited about it. And I had great mentorship from Dr. Pierce, among others, and everything, who helped me out and everything with my research, where I kind of took a look at, everybody's looking at the effect of kind of animals on people, like on what their blood pressure is, on what their cholesterol is, on their whole on their health and wellness, everything, which is fascinating and which is really where the research needs to go. However, nobody was looking at what was happening to these animals that were involved. And as a veterinarian, we're there to kind of safeguard these animals, like these working animals, service animals, and everything, to maintain their jobs so that they can maintain the best welfare. So my research was actually looking at the effect of animal-assisted therapy on the dogs themselves. So we were measuring their salivary cortisol, so looking at their stress levels, and also looking at behavior and everything. And so that was my like dissertation and everything, and master's and everything that came out of that. And between the actually like working in CPRAC and everything on community practice and everything, and kind of rotating through the other services and everything, I like had a wonderful experience. I learned so much, and a lot about teaching, again, about teaching veterinary students. And then at the same time, I was able to really like explore my interest in this whole other world of human animal interaction and what they call anthrozoology, the study of human animal relationships and everything. And it was just something that really took off. And it was just a wonderful experience for me.
So just a quick aside, were their cortisol levels higher than you expected, or I'm just curious.
Yeah, exactly. It was a really exciting project. So what I would have thought is that their cortisol levels being stimulated by like, it was like all these college kids and everything, you were playing with them and petting them for an hour or so. Because just out of natural excitement, like if you come home and your dog is like jumping up and down and everything, really excited to see you, their cortisol levels are going to go up. It might not be a negative stress. It's not a negative elevation in cortisol, but it's still like, hey, it's something different that's happening. And what's surprising is that the dogs that were actually in their therapy sessions, their cortisol levels were not different from when they were spending a day at home and everything with their owners. However, in one of our situations, I know, yeah. In one of the situations, I also put them in a neutral setting where it was just the owner sitting with their dog in like a new setting, so that the dog didn't have a purpose or anything. And in one of the situations, they actually went up. Their cortisol levels were higher in that instance, probably because they didn't know what they were doing there, and that they didn't have a purpose, they didn't have a job, nobody was petting them, and things like that. So that's open to interpretation. But it was just overall that there wasn't a difference. If you have a trained therapy animal and you're not doing anything out of the ordinary with them, petting them is not going to put them in a negative state of stress or so.
Oh, that's so good to know, and fascinating.
Yeah.
Really, yeah. I'm going to have to like look for you on PubMed.
I know. Yes, it was an exciting paper to publish, but I mean, like getting something published and research, there's so much that goes into it. So yeah.
I bet. Now, so quick question about ABVP, because I've been to the ABVP website, and you can see all the different specialties that you can get certification, board certification through ABVP. But it's a little bit confusing because a lot of them, it sounds like before you can even request to do a residency for ABVP, you have to have a minimum number of clinical years of experience. And I thought it was like you had to have 5 years of clinical experience to even be considered for an ABVP canine feline residency.
Yeah, that is correct. I know that it is a little bit confusing because nobody knows what the true process is. And so
you can't tell from the website.
Yeah, exactly. I know. You have to, that's why you need to talk to people and get that mentorship and everything, and that one-on-one with that. But as far as it goes, there are two options for it. So you can go in the route that I went and everything and do an actual residency, go to a training program that has an established residency program, which there's very few. There's probably, I would say that there's a handful. There's maybe like four or five of those programs and everything that exists in the country right now. But most people go about it in their own, like on their own and everything on their own route. And so with that, with a residency, they would recommend that you do at least a year of internship or whatever equivalent of private practice experience and then go into the residency. But you can do the residency and everything under 5 years. But if you're not doing a residency and you're doing it on your own, you do have to have a minimum of 5 years of experience. And then from there, you get a mentor, then you get all of your cases, then you get your like case reports and everything else all together. But it's kind of like equipping you. Yeah, again, like it's really like pushing you to your limit. It's not an easy thing. I don't know how people do it in private practice. All the people who have done it, I'm very impressed by, because it's a lot of work that goes into it, and you have to be dedicated because there's nobody necessarily pushing you to do that. Like at least in a residency, like my mentors are like, all right, this is due, like that's due, the other thing. And when you're trying to do it on your own, you're kind of like, I'm giving up because this is too much work and everything. So they don't make it an easy process and everything. So to truly distinguish those people who are willing to like suffer and get through and practice that standard of care of medicine.
Uh-huh, uh-huh. And so the research that you were doing and you got published and everything, was it, I mean, that must have been quite a learning curve, because, I mean, did you ever do any research projects when you're an undergrad or even as a vet student? Did you team up to do research with any of the professors?
Yeah, actually. So you know what? I had always done, it's funny because I always hated research. I never enjoyed it. I didn't think anything of it, but I pretty much did research all throughout undergrad, all throughout veterinary school, like as far as working in summer, like summer programs or whatever else, and just kind of being like the hands to like kind of help out and like with projects and everything from working with horses. Like I originally wanted to be an equine vet, actually. After going into undergrad, I worked in the equine exercise physiology laboratory and everything. I loved the large animals and everything, and I still do, but realistically, small animal was the name of my game. And then I did all this research with like chickens and with pigs and mice and then going into a little bit more into shelter medicine and everything. But the funny thing is that before that, or like all throughout that, I was never like looking to get published per se or whatnot. Like it was always just like I was helping out with this PI's project or that one or this one or that one. But it wasn't really meant for like, okay, I'm going to write this all together. I'm going to put together this manuscript. So it's a much different feeling and everything to kind of take the lead and everything, because I was not prepared for that at all and everything. And that's kind of what this residency and master's and everything was preparing us to do, was to kind of teach us how to write like science, like a scientist and everything, and to put everything all together. So it was a big learning curve. But it's a lot of work. But that just goes to show that for anybody who wants to go into veterinary school, or for anybody who wants to go to advanced training programs and everything, one of the biggest things that you can do is get yourself published. Like do a research publication or whatever way that really shows that you've been through like the peer review process and everything, that you know what it takes and everything. You know what the challenges are in creating science and creating good science and everything. How to research articles, how to put together like a citation list. There's such a diversity in skills that you get from research if you publish something. So that's probably my biggest recommendation. That makes you stand out, because nobody ever gets published. So when you do see somebody with a publication under their belt, you're like, wow, all right, they've been through it. They've been through like that whole like initiation phase. So that's a really good thing to be able to do.
And I've never liked research either. And I sort of lament that I as an undergraduate or through vet school, that I didn't get some research experience, because I have to wonder if, because you had all that research experience, that sort of gave you the courage to go after this, I mean, you must have.
Absolutely.
If you hadn't have had like that exposure, of course you're not writing the articles, but you were working with researchers. So it wasn't like a completely foreign land for you.
Yeah, no, definitely. And especially it has to be something that you are passionate about. That's a thing about all of this and everything. If you're researching something like, and that's the thing is that all those other research projects were like, oh, they're interesting and everything, but I'm not like in love with them, like to kind of like write it up and to go through all of this work and everything for it. But something that's in this arena now, finally found the area that I am like passionate about. I love talking about. I love like writing about and teaching about and everything. So that's really what it comes down to, because it's a lot of work and everything. And so if you're not passionate about it, just like veterinary medicine, if you're not passionate about it, don't like, I would not recommend it.
I don't think there's any lack of passion out there in future veterinary land. No lack of passion.
Yeah.
So then after you finished your residency at Virginia, Maryland, did you go directly then into a teaching position at University of Tennessee?
Yes, I did. So that is an interesting evolution because again, and so this is a story that I tell all the students and everything because I told myself I never wanted to do an internship. I never wanted to do a residency. Never wanted to be in academia. Yeah, exactly. Did not want to do research and everything. And so towards like in my third year, as I was finishing my residency, I was applying everywhere. I was applying for like positions where I was actually thinking about, I think my most ideal position at that time was to kind of be a veterinarian, like kind of working my way up towards being a medical director of a hospital. I was looking for more in the nonprofit realm of hospitals and everything, like either shelter medicine or elsewise and everything, and kind of creating like standard operating procedures, like kind of like overseeing, not as much like being an associate. That's the reason, that's the other benefit of doing this residency program, is to kind of elevate yourself from, no, I don't want to say just being an associate or whatever, but being like, all right, I'm going to climb the ladder. So I provide leadership and skills and everything else. And then at the same time with because I was like, what am I going to do with this master's degree and everything? And bond studies, there's not really a huge application of that other than if I want to consult with like kind of a therapy to animal organization or whatever, or kind of help provide leadership or guidance for other organizations like that. And so that's really how I was like, realistically, that's probably what I would do. I'd practice this high standard of care medicine, work my way up towards medical directorship, and also consult with these like human animal interaction organizations. So that's kind of what was set out for me, because I was like, I really don't know what I'm going to do. But all of a sudden, Dr. Pierce had actually, I was like looking through the listserv of like advertisements and everything. And there were a couple academic places that were looking for primary care veterinarians. And so I was like, interesting, like to kind of be on their faculty and all that. And I was like, that's an interesting role. And so I kept, and again, like I loved my role in community practice at Virginia Tech. And I was like, you know what? I was like, I love it, but all these institutions would be asking just for that, to pretty much be on the clinic floor, like for the majority of my time and everything, teaching veterinary students, which I do love and everything. But I was like, what can they offer anything else that's more? And so this position at University of Tennessee came about, and Dr. Pierce is like, you should definitely go for it. Like, definitely, like at least see what it's about. And I was like, I'm done with the South. I'm done with like Blacksburg and anything further south. I just want to go back up north to like New Jersey, New York City, that kind of area. And so I had heard a little bit about UT, but not a whole lot. I had heard I never heard anything negative about it or anything. And so but I didn't really hear one way or the other. And so once I finally got down to University of Tennessee, I was like, oh my goodness. Kind of like that first time when I went to my internship and everything, or the internship interview, I was like, this is a place for me. I fell in love within the first 4 hours of being there. I was like, oh my goodness, this place is such a different and amazing place and everything else. I love the people, and there were just opportunities galore for me there. And so kind of, I think that by the end of my second day of the interview there and everything, because I'd interviewed at a few other places, I was like, wow. I was like, I didn't think that I was going to leave the New York City, New Jersey and everything unless I found the job of my dreams. And this ended up being it. And so it really ended up being the perfect place because not only was it kind of primary care and everything of being like doing all the clinical stuff, but also because they had such opportunities with their therapy animal program, with their veterinary social work, which I can share a little bit more about,
Yes.
and like shelter medicine and everything else. And the people there, like the faculty and the students and everything, they were just so like open-minded, progressive, very inviting, warm, and welcoming. And not that I'm going to say anything bad about Virginia Tech, but I think that UT is it's a very warm and inviting place for anybody. And so like, it was just a very different feel that I got there. And so that's what kind of sold me. And that's where I am.
Well, let me ask you this, Dr. Ng, because I think that in the past, usually if you wanted to work in an academic setting as a veterinarian in a teaching hospital, you had to be a board certified surgeon or a board certified internal medicine specialist. So for, and I have heard of more teaching hospitals having community practice or general practice rotations because they're starting to recognize, hey, like, most of what vet students learn on their clinical rotations is like nothing like what they're going to have to practice to get
Absolutely
into the world. So that's why they've got these CPRAC or general practice rotations now. So they're starting to look for professors for those rotations. Do you have to be ABVP, canine feline residency boarded in order to be a CPRAC or a general practitioner in an academic institution?
No, not at all. I think that that's a kind of, in general, like, especially because it's only been recently that the AVMA has only like granted accreditation if they've had a community practice service. But I would say that it's probably 50-50 right now. Because we usually have an annual meeting of all the faculty who are community practice, who do work in community practice. And whenever they advertise for a position, it always does say like ABVP preferred and everything. But if you have an exceptional candidate and everything that's a DBM and everything, they will absolutely open them to that. However, for the most part, for like kind of in academic world, for like promotion and tenure processes and everything, they kind of do want you to get that certification and everything in order to get promoted, but it's not required at all. So I would say about half of the faculty who do teach in general practice, maybe it's actually less than half, are ABVP certified, but some of them are also like internal medicine. So my direct partner, who also runs community practice, she's an she's an internist. So she did her residency and did internal medicine training there, but she teaches community practice with me and everything. Okay. So I think that there's a diversity in whatever we can offer, but in academic institutions, no, not necessarily. I think that it just goes like the people who do go to that kind of level of training and everything are the ones who want to go into academia. So that's usually what happens.
Okay, good to know. So tell me about like, now that you're at University of Tennessee, you're teaching, what is your day-to-day or week-to-week schedule like? I mean, when I was a fourth-year student at Virginia Tech, my perception of the professors was they were on for rotation, and then they were off for a rotation, and then they were on, and then they were off. And I was like, oh, that's pretty cushy.
Yeah, right? We're just like sleeping, hanging out, right. Watching TV. All that
but
stuff.
As with most things, I think it's probably a lot different. The reality is much different.
Absolutely. And I think that's a really interesting perception that I feel like most students have of us. They're on clinics, and because that's mainly the time that they see us and everything. But then when we're off clinics, I try and like show my face as little as possible down in that clinic floor, because otherwise I would get sucked in and all that. But pretty much the thing that I love about being in an academia, again, like I never saw myself really here. I was like, I'm not smart enough. I'm not motivated enough. I'm not any of that, but it really is a perfect fit for me here because it is so different from day to day and from week to week, and it's really whatever you want to make of it. I mean, clinic time and everything is you have your set schedule of being on clinic, seeing appointments, doing surgeries, doing dentals, whatever else, teaching students, having rounds and everything. So that's a little bit more structured because we have a schedule. However, we have all those weeks and everything where we are off clinics and everything, so we don't have clinical responsibilities at that time. And so that's open to whatever you want to do. I mean, faculty can use that to like just sleep and go on vacation and everything if they want to, but I don't think that they probably keep their job for that long if that is what they would do all the time until they got tenured. But for right now, it's really whatever you make of it to show your scholarly activity. So whether that be like teaching, so like lecturing to the students, so in that off time and everything, I usually have like lectures or whatever that I'm preparing or giving, doing continuing education, preparing lectures for other continuing education purposes, and then writing and researching is the other really big thing, is that most of my time is dedicated to organizing our research projects, helping out like the students who are helping me. I have a research coordinator for another research study, and kind of writing and kind of helping out with all their projects. And that's really the great thing about it, is like, which I think some people can really fall in love with that style, or just be like, I can't do this, because there is no structure. It's really whatever your motivation is going to bring you to, because it's really hard. Like, I have to admit, like, that one of the hardest things is getting myself motivated to sit down to write that manuscript out, is to put my fingers in the keyboard and just like starting writing method section or discussion section and everything else. Like, I'm much more of like the hands-on, I want to be doing things or whatever else. But so it does take a lot for me to actually sit down and write out a paper or write proceedings and everything else. But there's just so much different day to day. And then I get like visited by all my like students who I also help mentor, and all that, and work with projects on all other programs, with our shelter medicine program, with our public health program, with therapy animal program, with our veterinary social work stuff. So it's just so many different things I couldn't tell you, like from a regular day to day. I'll tell you that I usually go to school with my dog and my cat. I'll be in my office for a majority of the day. I'll like visit around the hospital to everybody who wants to see the dog and the cat and everything. And then just go to it. But it's a lot of different things, which makes it exciting.
It's funny, you say that the lack of structure makes it really necessary that you be capable of motivating yourself.
Yeah. Mm-hmm.
But what I hear, Dr. Ng, is the lack of structure is a really great opportunity for a workaholic to just go to town.
Yes. You definitely heard that right. And everything is that it definitely can. And that is really like, I think it is like all people, everybody who is like, I feel like is a professor or else, that is their type A, like that they have to be motivated, that they want to do these things. If it's not because that they want to be like promoted or want to save their job, it's because that they are so passionate and they love what they do. And I think that's the only way. And I'm definitely not. I don't feel like I'm type A, and I'm not like motivated or whatever else. But the reason why I am here and why I am thriving is because I love what I do. So, and I'm like so grateful for this experience.
Well, I'm very happy for you.
And I'll have to say that, and it's hard because most of my other friends who are veterinarians and everything, who I graduated with or who are out in private practice, I feel bad because they're not happy for the most part. I was just, two of my friends were just visiting, and they were just saying, they're like, yeah, you're probably one of like the two people that we know who's actually happy in their jobs as vets. And I was like, oh no, that's like the saddest news ever. But I think that you have to find what really drives you and everything, what really motivates you and what you really love.
Right. And your method of doing that has just been like open to the universe. Like,
exactly.
Ask for advice and get to know people, and they know your personality. And it was, because Dr. Pierce knew your personality, and because your mentor at Cornell knew your personality, that she set you up with ASPCA. And
No, definitely. And it is, you have to be open. It's just is to not close any doors. Like the one thing that veterinary medicine, I think that is amazing about getting a veterinary degree is that you can do anything that you want with your degree. And it's only you who's closing the doors on any opportunities. And so things like all these things I said I would never do, internship, residency, academia, and everything, I originally, in my head, I was like, no, I'm not going to do that, or anything. Or the thing like China. How many people can just pick up their lives and just be like, all right, let me spend a couple months in China. And and that's what I always express to the students. I always tell them my story, like in a short, like 2 or 3 minute snippet about my evolution and as being a veterinarian and everything. And that the whole theme is never close any doors. You never know what opportunities and possibilities that are out there. So keep an open mind about it and everything.
Yeah, yeah. And it sounds like, you're keeping yourself open to specialization, ABVP specialization, but also, in undergrad and in vet school, maybe getting involved in some research so you can see the other side of veterinary medicine and you can not be so intimidated. Because I find it very intimidated because I've never done any kind of research. So to me, it's like, oh, that's a land where I don't belong and I won't be welcome. So it scares me.
Yeah, no, definitely.
If as an undergraduate student, you team up with a professor, just help out, just see, be a wallflower, whatever, just so that it's not so intimidating for you and you can understand that world exists. And if, you get out and you clinical practice or you want to do both, you can do both like you're doing, right?
Yeah.
I think they need to start in undergraduate and through vet school, keeping those doors open. Yeah.
And not being afraid and having like professors who are going to be welcoming and everything. And I've had plenty of undergrad students who've helped me out in research. And especially because my research isn't as clinical veterinary medicine oriented. Like one of my research projects is at the Children's Hospital, where we're looking at the effect of therapy dogs on the dosage of propofol that these kids need to go to sleep. And so like I've had undergrads help out with that. And we're looking at other like kind of hair cortisol studies. So kind of not your typical, is this medication going to work for like Addison's disease or something like that. And even though I still participate and help out my other like colleagues and everything with that type of clinical research and everything, my more thing is like this whole human-animal bond, human-animal interaction area.
Okay. Wow. Yeah. It sounds like you've got a wonderful life.
Thank you. Yeah, no, I definitely have to be grateful for, like, and what I always tell everybody is that this is my dream job that I never knew existed. And that's really the thing about opportunities and everything. And I don't think somebody else who came into this position probably would have had this direction to go in. If somebody was just doing like community practice, they could just do community practice and then just do their like, I don't know, clinical CE or whatever. But because I've taken such a route with my interests and I'm doing what I want to do, and you really have those freedoms as being a faculty member and everything to pursue those interests that, you're passionate about.
Yeah, yeah. And you know what? The word that comes to mind when you're talking to me is curiosity. You're curious about,
Yeah.
It's like that's what gives you your passion is you're curious about these different things. And
yeah. No, definitely that. It's always about exploration into territories that you don't know and everything else. And exploring and finding out new answers. And it's a very different life than your general practitioner, which I do. I have such respect for like everybody who does general practice. It's a hard job. And when I see our students and everything, and I do my best to get all of our students excited about going into general practice because they're on our rotation and we really give them autonomy. I tell them to think for themselves. I want them to come up with their plans. I want them to be the doctors, as opposed to all the other rotations where like the fourth year student is just like kind of their standby. I'm like, no, I was like, you are the doctor here. You tell them your recommendations. You have client communication, own your cases and everything else. And the students, they love it like that, because it's the first time that they feel like that they are respected and that they're true colleagues. But it's really an interesting evolution to see them at their first year of practice and being like, it is a sink or swim kind of situation and being like, I didn't expect this or expect life to be like quite like this as a veterinarian. Right. Sometimes it is disheartening or so, but there's a lot of work that goes into it. You're overworked, underpaid, and everything in a lot of those situations. But it really is. It's finding your passion and about that. But I realize that for myself, like I don't think that I could go back into private practice and be as functional as like everybody else is, and to work at that pace and everything, and to still develop their relationships with their clients while still like kind of maintaining a standard level of patient care and having like 20-minute appointments. Like those things those things are the things that give me anxiety. And so I have such respect for the people who are able to do that, and to maintain the paperwork on top of that is the other big thing.
Yeah, I think there are vets out there who'd be like, 20-minute appointments. Where do I sign up for that? Because I've worked at, where it's 15-minute appointments.
Oh,
Sick, well, 2 animals, 4 animals, whatever, 15 minutes. Yeah. Yep.
So
Interesting. Well, let me ask you because you are, I think part of the reason you're so happy is because you get to indulge your curiosity and follow your passions, like you were saying. But you are very busy. I mean, like the lack of structure, you can do as much as you want to do, and it sounds like you are doing a lot of stuff. So how do you maintain a work-life balance, or do you just love your work so much that is your life?
That is hard. No, I definitely. So in maintaining a work-life balance, I do. I have fun at work. I love the people that I work with and everything. And if I'm not just sitting there writing, I think that the hardest work for me is just sitting there and writing out like manuscripts, or I actually really like putting together presentations and PowerPoints and things like that. But actually writing out something is the work for me. And so usually during the day, it's funny because I bring my pets with me to work, which is a wonderful thing to be able to do, because then I can stay at work. Is that usually during the day, like between like 8 and 5 and everything, while everybody else is at work, like it's kind of just like casual. Like if I'm not on clinics, it really is like everybody's just coming into my office. They're playing with the dog. I'm just chatting with them and everything else, getting some work done here and there, working on emails. I think emails is the other big thing that I'm constantly always working on. But then it's not usually until after 5 o'clock that I can actually have time to myself, because I'm not being disturbed by people, and actually have the time to write. So a lot of times I will, if I have a due date or a deadline and everything, I will like be there for a while, but it's probably because I'm goofing off and I haven't closed my door to everybody who's kind of coming up to my office. I accept that and everything during that time. But as far as the other balance, I actually do. Like on the weekends, I really try to work minimally. If I do have work, it's working on emails or writing up papers. And then on the weekdays, like it's kind of like not saying no to people if they're like, hey, do you want to go out to dinner, or do you want to do this, or go out to that event or that event? And it's really nice having like other faculty, other people and everything that you work with, you enjoy hanging out with. And so usually I'll always be up for doing those things and being like, you know what, it's not due until like 2 weeks from now or whatever, so that can wait and all that. And so I'm a big procrastinator also, which is my detriment and everything, but it is what it is. So I think I try and maintain that work-life balance pretty well.
Okay. Yeah, no, it sounds like, when you're not on clinics, you're in your office and you can be pretty relaxed. And
and I really enjoy it. Yeah, absolutely. And so that's the other thing about private practice that I can see as being so trying, is that you're doing that every single day, and that there is no break unless you have your like even 10, I hear my friends having like 10 days of vacation throughout for an entire year. And I was like, are you kidding me? And I was like, so having those breaks is like essential to my health and well-being. And so, and when I am working or whatever, or when I'm putting together, it's not as much like I truly do enjoy doing those things. It's just the actual manuscript writing that can be a little bit tedious. But everything else, I actually find it, like if you don't work, or like, that you have to find a job. Like I also said this, like, don't tell my UT or whatever, but if I had the choice, like I would do this job for free. Like I would, I do. I really enjoy it. And I think that's the key, is that if you love what you do, you'll never work a day in your life. And everything. So I'm trying to maintain that insanity.
Wonderful. Now, I'm really interested in hearing about this veterinary social work program that you've got going there at UT.
Yeah.
Fascinating.
I know, isn't that so? This is a term that was coined by our very own Dr. Elizabeth Strand. She is a PhD social worker who's been at UT. She's done all of her training at UT, and specifically diving into the world of social work and veterinary medicine. And so I had prior kind of knowledge about social work and veterinary medicine from my like internship days and everything, and working at a practice in Brooklyn. And because there was a social worker who was married to a veterinarian, and together they created this practice and everything of like that was all about compassionate care for people living with their animals and all that, and just really delivering quality of care that really attends to the patient's needs while patient's medical needs while at the same time attending to the human's emotional needs in that time, because we always see all of our clients and everything sometimes the most distressed, the most trying, the most argumentative and conflicting and everything, all those situations that veterinarians are kind of like, they try and crawl into their shell. They're like, we don't want to deal with this. Yeah. If you have a social worker who's like there and they know and they're trained about those sort of things to deal with, and you send them on in, it's like the most amazing thing ever. And so I had experience with this, and I had worked, and so the AMC Animal Medical Center had also had a social worker for the longest time. She's one of my mentors as well. And one of the ones who I was like, should I go back to school for social work? Or so. And she's like, no, not if you want to make money. And she's like, what do you want to really do? But and I had like worked with their group. So they had a New York like veterinary social work kind of group. And a lot of them had come from University of Tennessee. And so Dr. Elizabeth Strand, she created this program that was called that she's part of the social work school, but she lives in the veterinary school. And kind of realized the need for social workers because of all the things that were happening to veterinarians. Number one, their compassion fatigue, everything that they're going through, and our veterinary students. Like, think of how many like veterinary students have like kind of emotional like instability and kind of panic attacks. These are all like kind of very type A, very driven students and everything who are put in veterinary school, and they're like just like pushed to the max about this. So kind of keeping the health and welfare of our veterinary students, while at the same time exploring all the other aspects of the emotional needs in the world of veterinary medicine. So whether that be dealing with grief and loss with pet loss, or dealing with animal cruelty cases and everything. So like, again, like knowing what to do if you as a veterinarian are suspicious that an animal is being beaten or something like that, like what do you do in those instances? And then exploring the world of human animal interaction. So using having a social worker use a therapy dog and everything with them, with whatever person that they're counseling with, and how to actually carry out what is a useful way to use these animals and everything while maintaining the welfare, while attending to the person's needs and everything else. There's just so much that is fascinating. And that was exactly that's the reason why I wanted to go into social work, and everything was specifically for this. And also the other big thing about it is communications and conflict management. So we teach through community practice. We have a very rigorous like communications training where we video record the students and everything in there. We go over them in a process of teaching of how they can do things differently with their communication skills and all that. So it's really, again, attending to the patient's needs while attending to the human's emotional needs during any veterinary situation.
So my first question, when you first started talking about these private hospitals that had social workers, because I know human hospitals have social workers, you know, they have ethicists, right?
Yeah, absolutely.
But like, what is the financial model that makes it possible to have a social worker working at an animal hospital? You send the client, I really think that you could talk to, our resident social worker, but you charge for it? I mean, how does it work?
So that's a great question. And I think that things that are just starting to evolve out, because more and more practices are getting social workers. And I think that it's usually, when push comes to shove, and I was working on this presentation, everything about what is the cost benefit and everything of having a social worker. So think about all the money that you're going to spend in kind of in kind of counsel the time that it takes for veterinarians to really counsel owners and everything with difficult situations, the impact on your staff and everything, and the reason why with compassion fatigue, it's a revolving door of having your veterinarians, your vet techs, and your assistants and everything in and out because they're tired of dealing with this, of all the conflicts and everything that are occurring.
As a veterinarian, you feel like you have to be the psychologist.
Yeah, exactly.
A lot of the time.
Exactly.
So
and then
somebody else can do that.
Absolutely. And all those sorts of things. And so you can't really put a price tag on those things, except, think about the hours and the things that you're going to have to do with hiring and everything you people are sending them off. So I don't know if we can put a true value to it, but when push comes to shove, we're working on surveys and everything to get out what a practice's experience are with social workers. But I think most of them do feel like that there is a need for them and that there's an area, like it's the greatest relief. As much as I love, like, I don't know if I would say I love, but I really enjoy dealing with those difficult clients or needy clients and everything. The bottom line is that they take so much time and energy for them. And as much as I want to help them out and everything, I just don't have the time to do that with those type of clients. But a social worker might and everything. If you have a social worker that you're like, you know what, I think that you would really benefit from speaking with our social worker who can help address all of these issues and take the time with you and everything for that would be great. And so, like, it's great when we're like, all right, we have somebody who's having a breakdown. Serena, like, come into exam room 14 right now. They're like throwing crap and everything like that or so. And so to have somebody to mediate and to take care of everything else while you go on to do your other things and everything is a huge benefit. And so I think the business model for it would be a profitable hospital who has the money and everything, who can take in somebody. And it doesn't have to be necessarily full-time or whatever, but if they just have a part-time person also to help like run their pet loss support groups, I think that's a bigger thing that's coming about. Or pet loss support groups, pet memorial celebration groups and everything like that. And also to help out with any sort of conflicts that are occurring between workers or between staff and everything, I think is huge. Because usually I think that is resorted to like whoever the hospital manager is or whatever. But if you have somebody who's really in tune with humans' emotions and feelings and is trained in that way, then I think that there are huge benefits to that. So, either full-time or part-time. And I mean, social workers' salaries sadly aren't really like huge or so. So I think that lots of them and everything that they can be afforded, even if it is just part-time. And like the social worker who is at the Animal Medical Center, I mean, it's a nonprofit hospital per se and everything. So they felt the importance and need of that and everything. And I think that it is very important. And the reason why UT is the way that it is because I think it is because of veterinary social work, because they really foster this feeling of like welcoming everyone, big hugs for everyone. And also, if you don't get along with somebody, you have to work it out. Like they're going to force you to sit, because if you don't work it out and that there's conflict on like a clinic floor or whatever, you know that Dr. Strand is going to be called in for an intervention between you and the other person so that you do work it out and everything if you don't do it on your own. And so those are the sort of things and everything that happen, and why I think that it is so welcoming and warm and very and a great work environment to be at and everything is because you have a veterinary social worker there.
That is fascinating. And I hope what you say is true, that it's becoming more and more common for private practices to get social workers. I mean, I would love to see that happen. And
I think a lot of people would, and think of what all the benefits are.
It's like a completely ignored dimension of veterinary practice.
Yeah, absolutely. Absolutely.
And here's the solution.
I think that there is a solution and everything, rather than having to cry your tears and everything in a bathroom or whatever, to have somebody to talk to when you've had a really rough day and everything, and an awful day, and where you've euthanized 5 animals or like something went wrong in surgery and you just can't go on. Like I've definitely had those days where mistakes happen or so, and you just feel like the worst vet in the world. And as much as like your spouse and your friends and your family members are there to like help and like understand, to talk to and everything, having somebody who's a veterinary social worker who knows all the struggles that you go through and everything, and to be able to just like be a sounding board for you is like, is wonderful.
So let me make sure that I understand this correctly. So Dr. Elizabeth Strand,
Mhm.
PhD at University of Tennessee, she actually teaches and trains veterinary social workers. So is it a special degree? In which case,
So it's a
like,
special,
there's just not
yeah,
enough of them, right? Well, like, where do
exactly.
you find a veterinary social worker? If I'm
I
inside that
know. So,
hospital, where are they?
yeah, I know. Where do they exist? So it's really funny because they right now. So these are social workers and everything. So they're getting their MSWs or their clinical licensed clinical social worker degrees and everything from UT. So they're part of the social work school. However, when they go on to do their specialty, whether they want to go into like children's or geriatrics or whatever else, like veterinary social work is an option for that specialty and everything. Just like if we were to have like ophthalmology surgery or whatever else. So
You're saying it's a common thing? Like every social work program in the country has a veterinary social?
Oh, no, it's just us. So,
it's just you.
But for UT and everything, that is one of the options where they can do their internship. And then also we have, it's a certificate that they actually get to specify them as a veterinary social worker. So it's called the VSW or Veterinary Social Work Certificate Program, and it's an online program. And then there's a capstone where they spend a week with us and everything, and that it's like a teaching thing and clinical simulation sort of lab. And so I teach the components. So the 4 parts of it and everything are the grief and loss, and everything is like one module of that session. A second one is cruelty, so the link between human and animal violence. A third is compassion fatigue and everything, focusing on that. And then the fourth is the animal assisted interventions. And so the animal assisted interventions, I actually teach that portion of the veterinary social work course, and everything, all aspects of that, about beginning to use that in your practice and everything. So it's once I get that certificate and everything, there's actually a listserv, and you can go to their website and everything to search for them. But people, and I'm on that listserv, so I'll always see the emails about the job postings that they're like, oh, this hospital is looking for a veterinary social worker. And because everybody is going through that program or whatnot, then they kind of know that exists. But I'm sure that if anyone was interested in getting a veterinary social worker or learning more about it, if they just go to UT's veterinary social work website, all the information is there, and we would find many applicants in an instant.
Oh, okay. Okay. Well, that's just because it's only just beginning. But I mean, I think if it takes off, as I hope it will, that you're going to have to, I don't know, maybe hopefully this online course plus maybe the 1 week, what was it that you called practicum with you?
Yeah.
You know, social workers who are training in other universities could take the online course to specialize in veterinary social work. They could take UT's online course and then spend a week with you, and then boom, they're veterinary social workers too. So as the demand increases, which hopefully it will.
Yeah, exactly. And they usually have like a field placement study or like some like internship type of thing that they do as well. So there's just lots of different opportunities. But it's a fascinating, and one of the reasons why I was like, wow, I was like, this is an amazing program. Love being here. I'm so glad that I can be a part of it and everything.
I love it. And thank you so much for telling me about it. And I'm going to I'm going to look for the information on UT's site, and I'll put it in the show notes. I know we're coming up to the end of the time, and I know you're very busy, and thank you so much for being generous. I've really enjoyed this. Let me ask you, 2 last questions. Okay. The second to last question is, what advice do you have, or what is the advice that you give the students that you're training? But what advice do you have for, future veterinarians in general about going into a career in veterinary medicine besides staying open? Is there anything specific?
Yeah. Staying open, knowing that never closing your door on an opportunity. That's the one big thing to take home. And developing relationships, and looking for mentorship and everything. And also, I would say not being afraid of failing. That it is absolutely okay to fail at something, whatever you're doing and everything, because those failures are mistakes that are made and everything. As bad as those days can seem and everything and all that, there's something to learn from that experience, and something to make you grow, and something to make you who you are today. who you are today. And that's one of the questions I actually ask in vet school interviews.
Oh, you do interviews.
Yep. So is one of my biggest questions is because all of our students and everything who apply, they are chronically high achievers and everything. They are high achievers. They're type A personalities and everything. And if they fail at something, like their world is ruined. And so one of my questions, and you have to have resiliency and everything in vet school. If anything's going to chop you down, it's going to be vet school. And so I always ask, I was like, what is one thing in your life that you failed at? And how have you grown from that experience and everything? And I think that it's really important to either, like, whatever your interpretation of a failure or whatnot, but to actually state, I didn't do something perfectly, it means that you're a human being. And so go out and try all these different things and enjoy it and have fun. And if you're not having fun, if you're not enjoying it, try something different. Not to say just like give up on something, but do what truly makes you happy.
Wonderful. So the last question is, do you have a favorite charity that you would like to tell future vets about? And maybe if they enjoyed the talk with you today and got value out of your interview, they'd be willing to maybe consider making a donation too?
Oh, wow, that would be so kind and generous of people. But actually, so the therapy animal program that I work directly with and help advise is called the Human Animal Bond in Tennessee, so also known as HABIT or Human Animal Bond in Tennessee. And so we have over 350 volunteer teams and everything all throughout East Tennessee that go into hospitals, nursing homes, schools, you name it, and everything. And they bring the trained therapy animals to these programs, bring joy from all that human-animal interaction. And so, yeah, any sort of giving and everything is always greatly appreciated. But, I mean, yeah, give to anybody. I think that any organization that helps people and animals is a great organization.
All right. Well, thank you again, Dr. Zenithson Eng. Thank you so much for your time. I've really enjoyed it. And on behalf of future veterinarians who will benefit, I thank you as well.
Thank you very much.